Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Before we discuss hepatitis, let me go and explain what happened to that patient, that old patient that came in, 71 years old, with abdominal pain, and on scanning we found that he has a lot of a lot of abdominal ascites, a lot of fluids inside the abdomen, and we find the small liver. We wanted to know the source of ascites. Is it because a bad heart can give you that? Is it because the liver? And obviously we've seen the liver small and cirrhotic, so the liver is definitely the reason. But we also have to check the kidney, see if this guy is leaking protein or not. When we talk about ascites, we have to think the cause of ascites. And I know the cause of ascites is because we have lost protein. We have lost albumin. We can lose it through a bad kidney that is leaking protein, leaking albumin, or we can lose it because the source, the factory of albumin is no longer working. And we told you a minute ago that the factory for albumin is the liver. So when the liver fails, albumin is no longer produced. We ran the creatinine urea in this patient. The kidneys are fine, but in the urine we found a little bit of protein, so that means the kidney is a bit leaky to protein. So, but this is not the big reason why he have an ascites. Obviously, like I said, and I say again, is the liver failing to produce albumin. So when we measure the albumin for this patient, surprisingly, the albumin is 2.8, which is low. He was supposed to be at 3.6, 3.7 minimum. So he's missing about a point there. And that makes a lot of difference. So I'm gonna, when we have abdominal ascites, we have, a little bit of vicious circle. We have a bit of, challenging situation. Why? We have fluids in the abdomen. We're gonna tap. Tap meaning I remove some of the fluids out so the patient can feel better. Remember, in the abdomen, in the top of that abdominal cavity, we have the diaphragm. The function of the diaphragm is to move down and to move up, and this is how you breathe. So if I have a lot of fluid inside the abdomen, the respiration, in, down, and up, and you take in air and you let out air, this mechanism is already being compromised. Why? Because we have a lot of fluids inside the abdomen, and that too much fluid, which we call ascites, has restricted the movement of the diaphragm up and down, up and down. This is how you breathe. Yes, this is how you breathe. So as a result, that patient, oxygen saturation should drop, and it did. So normally what I have to relieve the patient at this point, and I have to tab him, meaning I take some of this fluids out so he can relieve, I get the patient relieved, but we have a problem. You remove some of those fluids out, in a matter of days, the fluid comes back. Why? If you already removed the fluids, why would the fluid come back again? Because it's a matter of stability, equilibrium. We said the liver is the source of albumin. Failing liver equals to less albumin. And we said the function of the albumin is to make the blood stay in those blood vessels. If I lose albumin, I lose that force that keeps my blood inside the vessels. The blood oozes out to the nearby organs and tissue. So in case of the abdomen, we have a lot of vessels there. We have the inferior vena cava, and we have a lot of vessels there. Then the fluid oozes out to the abdominal cavity, and now we have ascites and big abdomen. So the only way I can prevent this fluid from leaving the vessels, leaving the blood, going to the nearby cavities like the abdominal cavity, is to increase the albumin. Common sense, right? So okay, so what will be the best management for this case in this scenario here? If we don't correct the albumin, the patient will continue, no matter how much you drain him, he will continue to make fluids in the abdomen again. So it is actually, you know, like a vicious circle. You remove, he adds. You remove fluids, he adds fluids. So if you fail to correct the albumin level, the story will continue. The story will continue. So that now we need to correct the albumin. We need to give him the albumin that his liver cannot make anymore. You know, we have not reached big complication in this guy yet. We're only talking about deficiency in albumin. But yet there is a lot more complication. When that liver becomes cirrhotic, that means, cirrhotic meaning it becomes hard, like this table here. So those vessels, blood supply that run inside the liver, they became constricted. We put a lot of pressure on them. So now what we call, those veins, we call it portal veins. So now we have increased pressure in those vessels that lie inside that cirrhotic liver. As a result, we have portal hypertension and increased pressure in those veins that run inside that cirrhotic liver. That high pressure will be transmitted back to the systemic circulation. Then we have veins here at the esophagus. Boom, they blow up. We have veins here around the umbilicus. Boom, they blow up. We have veins in the rectum. Boom, they blow up. So we have a patient now that is bleeding from above, bleeding from below. That's a lot of loss of blood, right? Then we go ligation. The ligation doesn't last because the pressure is still increasing in the liver. To that increased pressure is transmitted back to the systemic circulation, especially around the esophagus. You ligate one session, after 2-3 months or so, or maybe less even, boom, again, the veins rupture and the capillaries rupture because of the increased pressure. This patient has not gotten to that stage yet, but eventually he will get to it. I am not trying to scare you off. I'm trying to transmit the picture exactly as it is. So you know when you have hepatitis, or when you do not know that you have hepatitis and suddenly you get surprised by abdominal ascites like this patient, you're not, I'm making you aware. So maybe this session will save your life. Let's now discuss about hepatitis a little bit. This is the virus. This is the hepatitis virus. Out there, those projections, those ones in red, you see those ones in red there? This is what we call surface antigen. And then the blue line, the blue circle there, that's what we call envelope. And then the genetic material for that virus, which is DNA, that green thing there, that's what we call the genetic material, we call it core. That's all. This is what the virus looks like. It's just a piece of genetic material covered by an envelope, which is a membrane. And on the surface of that membrane, some projections, we call it surface antigen. This is what the virus looks like. We're going to keep this picture with us, and we'll discuss about hepatitis. And we see Let's keep the image back and we'll discuss about the different components of the virus. Very essential that we understand how the virus work so we can avoid what we can avoid. The most important part in this virus for us as doctors and clinicians is that surface antigen, that red thing there that we call hepatitis B surface antigen. If you are tested and there is no hepatitis B surface antigen, you do not have hepatitis. So in order for you to be hepatitis B positive, you must have that piece of the surface antigen. That's a must. And for you to know, hepatitis B surface antigen is the first to show and the last to leave. Meaning what? Meaning there is other markers that we will look for that will tell us a thing or two about the progression and the nature of this disease, this very bad disease. So again, to repeat, if you go to the lab and your surface antigen is called S antigen for surface, that red one there shows up on your blood, that means you definitely have hepatitis. Now, the second one, which is the blue line there, the blue circle, that's what we call an envelope. If you are tested in a lab and the E antigen, for E for envelope, a piece of that envelope shows in your blood, that means you not only have hepatitis, but you have hepatitis and you are transmitting hepatitis right now. So if you sleep with someone and you exchange fluids with that someone through sex, you're definitely giving them the virus. So as long as that's hepatitis B, E antigen, that blue circle there, a piece of it shows in your blood, you should not have sex. Because now you are transmitting the virus to your partner. All right? We look now at the green stuff, the green structure there, okay? That green is the core. We call it the core, the genetic material there, the DNA material there. That is the core. This core, if it shows in your blood, that means we only have antibody against the core. We do not have any other test. We only can test for an antibody against the core. Antibody meaning your body has formed an antibody to attack that genetic material, that virus. That's what it means. So now, you can bring me, that's enough. Everybody has seen the picture of the virus. We can go back. So now, if you are hepatitis B surface antigen positive, if we test you and we find hepatitis B surface antigen, you are automatically hepatitis. That's it. There is no negotiation. S antigen, the surface antigen is there, you have hepatitis. If the S antigen is there and the E antigen, which is a piece of the envelope, is there, you're not only having hepatitis, you're having hepatitis and you are capable of transmitting the virus to somebody else upon contact, sexual contact. If you have the core antibody, hepatitis B core antibody, and the S antigen, you are chronically infected. If you have the surface antigen, you look at your labs, if you have the surface antigen and you have the core antibody, you have chronic hepatitis. If the S antigen has been there for more than 6 months, you have chronic hepatitis. Then what happened? Well, you are a carrier. But hepatitis is a unique thing. When it comes to carrier state, is a unique thing. Only if you have the E antigen positive, you are a carrier that can transmit the virus. If you only have the S antigen and the core antibody, you are a healthy carrier. You have the virus chronically, but you cannot transmit the virus. Only if you E antigen, if the E antigen is there, you can transmit the virus. Beside that, you cannot transmit the virus. That is why we get couples, married, husband and wife, we check them. The husband have it, the wife don't have it. How is that? Isn't the disease sexually transmitted? Yes. But you have to understand the mechanism of the disease and the mode of transmission and what is needed to transmit the virus. So what is needed here to transmit the virus is the envelope. The envelope is just like an envelope, like any envelope, the post office envelope. The DNA material, the genetic material cannot be in the air by itself and transmitted through vaginal or seminal fluids like that. No, it has to be covered for protection with that envelope. That is how it can move from one place to another. So I need the envelope to transmit that genetic material, the DNA genetic material of the hepatitis B virus, to move from one person to another. Without the envelope, the genetic material cannot go anywhere. So now you understand. If you look in your labs and you find that you E antigen positive, you hold no sex because you are transmitting the virus. So in summary, that virus needs an envelope to move from one person to another. And that person that envelope we can easily examine in the lab, and we'll see E, we call it E for envelope, E positive, E antigen positive. That means you have hepatitis. So if you have the E antigen positive and the surface antigen positive, you cannot have hepatitis without the surface antigen. No, you cannot. So if we have the surface antigen positive, the E antigen positive, and the core antibody is there, that means you have chronic hepatitis and you can transmit the virus. If we have the surface antigen positive and the core antibody positive, you are chronic hepatitis, but you cannot transmit the virus. You are just a carrier. Now, there are good things. Hepatitis is not all bad. There is good things about the liver in fighting hepatitis. Hepatitis B is a DNA virus, and the virus have only one mission in life: multiply. They do not know anything else in this life except they go to the hepatocell, to the liver cell, the building unit of the liver. They go inside and they take control of the cell. It becomes a host and they multiplies to thousands, and then the cell will burst because they became too much, and that new virus will go and infect the nearby cells. And the story continues. Multiply to thousands, and the cell bursts, and after the cell bursts, is like a wound now, right? So it becomes a scar, a small scar. This happening to millions of cells, so we have millions of small scars, and that is later on what will be called cirrhosis, liver cirrhosis. This is the bad thing that the virus does. Attack the cell, multiply, the cell bursts, the viruses come out to infect new cells, and the story continues. Each cell that bursts, it becomes a small scar. Adding all those scars together will make you the cirrhotic liver or the fibrotic liver, like in this old patient, and then you get into the complication the same old patient get into. It doesn't mean that only old people get it. I've seen young people who have, many young people who go into liver complication, especially if they have a co-infection, especially HIV. HIV and hepatitis B do not mix. So that's what the virus does. But what about you, your own liver, your immune system? It doesn't have a say in the matter? It does, and it's a very good way. The liver have regenerative capacity. Regenerative capacity means what? It can regenerate itself. Meaning, if I give you a quarter of a liver of somebody and I plant it into you, after some time, that quarter there becomes a full liver. It grows, it regenerates. So we have one power that kills the viral load and the replication of the virus, which is regenerative capacity of the liver. On the other hand, we have the viral load, that virus multiplying and becoming more. So now we have regenerative capacity of the liver opposed by the viral load of the hepatitis B. Whoever wins, decide your fate. If the regenerative power of the liver wins, you recover without medication even. If the viral load wins, you get into liver cirrhosis and eventually, sometimes, actually most of the times, into hepatic or hepatocellular carcinoma, cancer of the liver. Okay? I want you to think about this for a second. You can naturally kill the virus if your immune system is good. So the minute you know that you have hepatitis, you have to keep your immune system up. You cannot take steroids at any given time. Steroids are no. When you're in a state of hepatitis, you cannot take steroids because that will lower your immune system. The virus wins. So, yes, the immune system can, a lot of people recover. If you're young, immune system is good, you recover. But you want to take the chance and just wait. Maybe you recover, maybe not. Or you want to seek treatment. So you make sure that you recover, especially when you're young. Yeah, I want to seek treatment because I want to enhance the recovery. Let me take a minute break and we'll come back.